I'd like to introduce Dr. Akbar Khan from Toronto in Canada, who is the founder of the Cancer Medicare Centre. Thank you for joining me, Akbar.
Oh, you're welcome. It's a pleasure.
Could you tell me when you first heard about LDN?
Yeah, we first heard about LDN about 5 years ago. Um, it was from a patient. This is how we hear about a lot of our complementary therapies. It's through patients because drugs like this, there's no sponsorship for. Very cheap drugs, generic drugs. Drug companies not actively out there promoting these drugs, so we hear about them either through patients or through our own research.
Mm-hmm. So did you start using it 5 years ago?
Yeah, it was about 5 years ago, and what we did was a patient brought it to our attention, so we started doing some research, and we found a very useful website called www.ldninfo.org, and that website was founded by the doctor who discovered the use of LDN, which was Dr. Bihari, and it's now run by a colleague of his, Dr. Gluck. And on that website, there's a lot of factual information about this medicine, and that's how we really started to learn about it.
Mm-hmm. And what's been your experience in that 5 years of prescribing LDN?
Well, what we're seeing is that it's a very useful drug. It's definitely very, very safe. It requires very little monitoring in the way of blood tests because it has essentially no toxicity. We are definitely seeing results. What we're finding is that it's much better to use the drug in earlier stages of cancer because it does take time to work since it's so gentle. What my estimation would be that it takes 2 or 3 months at least before you start to see the results. So I prefer to use it in earlier stages of cancer, before the patient is very end stage and have failed all their chemos and are coming to us with a very poor prognosis. So we're definitely seeing results for various types of cancer. And in fact, we have a case that is publishable right now of a fellow with a tongue cancer who was told about 2 years ago when he was diagnosed that his tongue had to be removed to treat the cancer. And he absolutely refused because there would be no quality of life. So we treated him with LDN along with some vitamin D, and now he's in complete remission. He just sent me his MRI scan a few weeks ago, and I've looked everything over, and we're hopefully going to publish the case.
Wow, that's amazing, isn't it?
Yes.
What other treatments do you use alongside of LDN if patients come to you early?
Well, we definitely make sure that they're supplemented adequately with vitamin D, and that often means high dose, so much higher than what the standard guidelines would recommend. And we do that with blood monitoring to make sure they don't have toxicity. We also use various natural medicines. Now that's not my area of expertise, so we have a naturopathic doctor on site who the patients also consult with, and then he'll prescribe appropriate evidence-based natural medicines. Also very gentle, very safe. Then for some patients who want a little bit more aggressive therapy, we do intravenous therapies as well. And one of the drugs that we're using is called dichloroacetate, or DCA. That's a more powerful drug than LDN, also has more side effects and requires more close monitoring. So some people are candidates for that. Then we have a drug which is a copper binding agent, and we use that to create a controlled copper deficiency. And that's been studied very well in the US. Has been found to work as an angiogenesis inhibitor to blocking the growth of blood supply in tumors. And it has clinical data behind it as well. It has phase 2 trials that support its use. So we're using that drug as well. That's called tetrathiomolybdate. And we have a number of other off-label drugs, which are, again, they're not approved for cancer, but there is some study behind it that shows benefits in cancer. An example would be something like ribavirin, which is an antiviral drug, but it also has anti-cancer properties. So that's a small sampling of what we're doing. And I mean, obviously, there's more drugs than that, which probably you don't have time to hear about today.
So what would your opinion be of somebody who's been diagnosed with cancer? What would you suggest they do?
Well, the ones that are diagnosed with cancer where it's curable readily by conventional means, I would recommend that they should take the conventional treatment. However, there's patients that are diagnosed with rare cancers where the oncologists don't really know what to treat it with because there's no good study behind it. Just because it is so rare, it's hard to research it. So those patients, I think they should be looking elsewhere. And then patients who have been diagnosed with cancer that is metastatic at the outset, and they're being told that it's not curable, and the prognosis is not very good with conventional treatments, I think they should be also looking elsewhere. And LDN would be one of the options.
Well, thank you very much for sharing your experience with us.
You're welcome. It was a pleasure. Thank you for having me.